There are, 500,000 Americans who have esophageal reflux disease, and perhaps 40% of them are not well managed on medicines and could be considered for some type of non-medical therapy. The Linx procedure is really an ingenious new device that a company in Minneapolis called Torax developed. And what it is it's magnetized titanium beads that make a little necklace, and you put it around the esophagus so that when you swallow, the magnet will open up and you can swallow normally. But when pressure gets high in the stomach and stuff tries to get out of your stomach back into the esophagus, the magnets hold things tight. What makes the Linx device different is that it's a dynamic device. It's not a fixed, rigid device. It moves much as a natural sphincter would move. And it's also encircled by normal human connective tissue that makes it biologic, soft, and pliable, so that it's not a device that is putting pressure on the esophagus, eroding into it. It's moving and functioning with the esophagus. The one drawback of the magnets is that if you were someone who were going to need an MRI scan for follow-up of some medical conditions, that you could not get an MRI scan, and that indeed in the future could be a cause to have the Linx device removed. Patients who benefit is someone who really has bad heartburn or bad reflux, gastric contents getting up into the esophagus, causing injury or regurgitating food or irritating the upper airway that medicines don't take care of. So they have some sort of a weak sphincter problem that needs a mechanical solution. And the best patient is someone who has good function of the esophagus, so they have a strong esophagus that squeezes with good strength, in that the anatomy is not distorted, so that it would be a patient who doesn't have a big hiatal hernia. And the Linx has been used in patients for over 5 years, and there really is excellent outcomes with success in improving quality of life, in cutting down reflux episodes, and in taking away the symptoms that bring people to doctors in the first place. It's no longer experimental or a study device. It's approved, it works, and it's ready to be used. And MUSC is fortunate enough to be the first center in South Carolina to introduce it into patient care.